Hi, everyone. Wow, I would like to take a moment for parents, but it would take from my 10 minutes. But I just feel like parents and caregivers, I hope that you are seeing yourselves reflected in some of these accounts. I hope that you're understanding the critical role that you play. And it's through that lens that I share what I have to share. I don't come to say, here's the list, very much as Mary shared with us. I come with respect for the role and the special position that you play, your sphere of influence in making things better for your child. And am I the silver or the black? Yep. Yeah, thank you. Is my pants rolled up? Thank you. Okay, good. Okay, thank you. Silver it is. Okay, so with that, I was asked to speak about effective communication, and I thought, difficult to speak about communication without also speaking to all of the other contextual things that matter in this very important relationship between parents or caregivers, words that I'll use, interchangeably because I believe caregiving is the central feature, no matter whether you're a biological parent or not. But if you are in that caregiving role, you're doing a number of things, and this is just an attempt to highlight some of those things that, of course, built into parenting is child rearing, right? You're raising a child. You're conferring protection and security, and sometimes that's physical safety, but it's emotional safety as well. Teaching and discipline, and those are actually the same meanings. Sometimes folks think that discipline is about meting out a consequence for a behavior that's negative or so toned, but discipline is teaching. That's what it's about. Attachment being a foundational piece of all of this, and attachment, at least according to the theory developed now decades ago about that caregiver-child relationship, speaks to something foundational, connective, and that confers a lot of safety for children to go out and explore. That secure base is the language that you'll hear often in speaking about attachment relationships. Communication is all in there as well, right? It's something we're doing every day, in many ways, as I'll touch on. And I think in all of that parent-caregiver-child relationship, we're nested within a few things. I don't want to forget the importance of parent well-being. I want to thank Mary and Tanya very much for speaking to the importance of that as a fixture of how we care for our youth with sickle cell. Child well-being, clearly, just living with disease processes and those impacts on development. And then thinking about resources. It's very difficult to do anything well when you're under-resourced, and that's not always material support, that's emotional, social, having frameworks around to draw from to help you do this important role. With that, I thought I would just go over a few things and try to tie them together. Again, thinking about that communication piece. I will get to that, but I want to start by just recognizing, and I started off with a thank you for the caregivers. I want to speak to, not that this is the whole of the experience of parenting, of course, but when chronic illness is there, and sickle cell certainly is a form of chronic illness, there is significant stress on parents, right? And I whether a parent, perceives that and subjectively reports the stress, or it's something that's observable, maybe matters little. The truth is we know it's there. And it's super important to think about features of what the child is coping with to understand that parenting stress piece even more. Sickle cell is a variable condition in terms of severity, the number of complications and behavioral issues. You've got the health pieces and then you've got the developmental and behavioral pieces. That combination seems very important for understanding how much parenting stress a parent may report when they're supporting a child with chronic illness. And we don't want to forget what the features of the caregiver need to be as well, their own resilience, right? Maybe the word of the weekend, right? Their mental health, the resources they have, how they see their child in themselves, their coping style. Mary mentioned parenting style. Really enjoyed that really. And those are things that are important as well. So we take for granted then that when there is a chronically ill child in the family, it's going to have an impact on the family and on the caregiver, and vice versa. The caregiver's well-being has impacts on the child. In the sickle cell context, just to narrow it a bit more, there are a number of studies that have looked at what they call parent adaptation, coping, things like that. And psychological distress is reported at significant levels by parents with sickle cell, but so are resiliencies, and I don't want to lose that message. I know that I said it was the word of the weekend, and I meant it. It is possible to thrive through difficulty. It's just not to say that there isn't difficulty. It's to say that there are factors that, can be done to keep people buoyed and hopeful. Parenting styles, which were also touched on a bit earlier, can be variable. So there's been a lot of research to try to kind of describe the styles that parents have with regard to, meeting their child's behavior and other needs. You heard mention of authoritarian and permissive styles, which I highlight here. It seems that in studies of parents or caregivers of children with sickle cell, those were the types of styles, authoritarian being that very much inflexible, my way, or the highway, or permissive, the complete opposite, saying, listen, child leads and there's no sort of in between. Those tended to be less successful approaches to dealing with things like behavior. You've heard the importance of structure, you heard the importance of consistency, and those are things that children need for safety. So again, not about judging a style, but understanding that some styles meet needs better than other. When it comes to communication, so important to remember that it is more than words, right? It's actually the name of a program for very young children with speech language needs. We confer a lot of information through our nonverbals as well. And again, we want to, in our interactions with kids, confer both, we want to communicate what we need, but we also want to confer that safety and that assurance that connection remains regardless of what we're dealing with. And with that, behavior itself is communication. In my business, we often talk about functions of behavior. And these are things we theorize about. What might be behind the behavior? There are sort of 4 classic things, attention being one, escape from a task that's unpleasant being another. But if we are really curious, it seems, about what is going on with children and with ourselves when we're having interactions with them, no matter the topic, I think that we go further rather than to sort of mindlessly use certain approaches. I think we want to be informed by what's happening within us and within them. As was said earlier, really effectively, emotion regulation is important for both caregiver and child. It's important to learn and shift behavior when you're heightened emotionally. It's also difficult to give instruction and parent from your best place when you yourself are heightened. So having that ability to regulate and taking concrete steps to do that, super important. You also want to think about the cognitive pieces for children. Like, how much are they understanding in those moments of heightened behavior? How much can they express? All of these things are in the way, and we need to know that and think about how to work with that. I also think that super important, and not just my opinion, but well documented, kids need to have the skills to do the things that we're asking them to do. And when there's a mismatch between the demand and what they bring, we tend to see things fall apart. So when we're giving a request to a child, we want to think about developmental level, their maturity, their readiness, their skilledness to do what we're asking. So all kinds of things built into what looks like just straightforward communication. A lot of thinking about the things happening around and the context that supports that effectiveness. So with that in mind, and I just have a little quote here saying that challenging behavior, just as I said, is telling us a lot of information in the moment about the demand we're making and the expectation, and whether it is actually a match for what the child can do in that moment. I think having that understanding has crystallized things for a lot of people. They may choose a different time, a different way. They may teach a skill to help a child meet that expectation differently. Thinking about communication and its effectiveness very quickly, I won't read all of these, but I hope you'll see on this list a number of things that are highly correlated, right? A parent needs to feel that efficacy in delivering the request they want. I have to feel that as a parent, I'm able to give that. Thank you. I need to know that I'm consistent in what I'm asking. Children are learning about us and from us all the time. And so inconsistently sometimes confers feelings of lack of safety or lack of security, in an interaction. When they know what to expect from us and learn that we are consistent with what we do and when, as much as we can be, not asking for perfection, you are teaching an important relationship and relational thing for children. Warmth and empathy, so important that they're embedded in whatever we do, no matter what the issue is. The idea that connection does not disappear when there are ruptures or things that, are impasses, temporary, that it's restored at our earliest opportunity. I have personally really been intrigued about parenting approaches that encourage, I haven't changed that for a while. I'm so sorry, everybody. That problem solving, where possible, is collaborative rather than parent to child at certain points and maybe even early ages. The ability to have parents and children collaborating to solve a problem. In other words, they're on the same side of the issue rather than at odds. That confers a very different sort of problem solving process, and it teaches children a lot in terms of modeling. Some quick questions, so many things, and you may say, well, are you asking me to do all of this in a moment that I'm at sort of having a problem with my child? And I would say that I think with practice, these things become easier. I also understand that sometimes it's the reflection that happens later that allows these sorts of things to happen, and you have a strategy for next time. But I really draw from PACE, an acronym which refers to playfulness, acceptance, curiosity, and empathy, dealing with children of all ages, and certainly a trauma-informed lens as well, which says, being curious about what's happening within ourselves, as I mentioned already, what's happening within the child, the outcome that we're focusing on, how to actually communicate that request in a helpful way, and how to help a child do that. Can they really do what I'm asking independently, or is help or further skill building needed? Is this the right time? Is this a priority? These are things we have to think about all the time. The other parts of PACE that are really important is that it's so relational, right? There's empathy and wanting to understand how something is feeling for a child, and as well as wanting to accomplish our own goal as the adult involved. With that, if there were a quick tips list, certainly not exhaustive, but starting from a lens that says that kids do well if they can. Not so much if they want to, but if they can, I think is a frame shifter. It says, if there's a problem behaviorally, something's in the way, what could it be for my child based on what I know about them and the situation? How do I use that to build a bridge and help resolve this? And I offer a few ideas here, certainly meeting developmental and behavioral needs that, happen within sickle cell as well. Children with sickle cell are diagnosed with ADHD. They have mood and anxiety concerns. There are lots of things that can get in the way of self-regulation and behavior, and they need to be addressed just as the physical condition would need to be. I really encourage looking for strengths. In other words, catching kids doing good. Turns out we get a lot more payoff from building what's positive than trying to punish what we want to change. That is considered a, quote, negative behavior. And that shift in frame does a lot for kids. They feel successful, and I think parents also can feel like their relationship stays more positive. Super important to teach the skills that are missing, and there are lots of great inventories. I mentioned Green, Dr. Ross Green, who actually coined that kids do well if they can, wonderful clinician. Again, what needs to be built to help this child perform this differently? And I would say as parents, as much as you are teachers and models, you can also be learners, right? You have your support groups. There's so much literature out there, and now podcasts, all the rest. I don't want folks to forget the network they have. Just as they pour into what you are trying to accomplish, so can you with friends and others. Parent groups, support groups is another way to get that sort of take on a situation you're dealing with. And I think if folks like myself, clinicians in the hospital, others in your network that can provide support for those trickier issues. Almost at the end, I wanted to just quickly share just some images of some books that I've really enjoyed recommending to others and also flipping through myself. left to right, how to talk so kids will listen, and so listen so kids will talk. Notice both ingredients are important. I have a close colleague who wrote What to Say to Kids When Nothing Seems to Work. And these are books where you're going to find the importance of validation, or figuring out what makes sense from a child's perspective becomes central to getting them to collaborate with us, starting with that. Good Inside is a really great book about understanding building that confidence and sense of efficacy in yourself as a parent, so that when you engage with your child, it's from that place of strength. I mentioned Dr. Green. This is one of his most famous books, and he teaches that collaborative and proactive solution. So collaborative, working with your child; proactive, meaning what can I do to get ahead of this and help the outcome be a more positive one. Another popular publication from recent years is The Conscious Parent. Notice that these may suggest child behavior is at the core, but they're also very much about building caregivers who have the skills to do what they want and to be the models they want to be. So with that, also just a mention of two great websites about kids' health, which comes from Sick Kids in downtown Toronto, and Child Mind, an American site. Both of these, I think, have been wonderful sources of parent-friendly info, and I hope you'll check them out. So thanks for your time.
Okay, I think we have 5 minutes for questions, maybe 4. Okay, we're just going to open the floor for questions, and I'll wait till I'm cut off. So the questions are for anybody on the panel, and we would like to go ahead and open the floor. Oh. Serena has a question. Oh, just in the corner. Yep.
Thank you, presenters. This was amazing. I just wanted to ask a question, though. You have support for the children and the parent in this way, but because I'm a parent living with sickle cell and have a child, is there supports for that person? Because, well, she's an adult now. But, we need supports for those kids too, because I've noticed how certain things throughout my life has rubbed off onto her because of my illness. And I'm just wondering if there's a way, because there's not really much of an outlet for her to talk to anybody else. And then the lack of social workers and so forth in free spaces, I guess, is not available for her as well. How could I support her? Would those books be good as well? Like, could I, how could we support the kids of the ones that have the disease? That's what I want.
Someone wanting to come up and give their thoughts about it? Yeah. Oh, do we have a mic that we can just...
Go up? Okay.
Now come up here. Did you want to come up here for now?
Testing.
Thank you. I'll take a go at this, and I thank you for the comment, Serena. Such an important situation where child and parent may share a condition, or child of a parent with sickle cell has observed things, as you've mentioned. I don't want you to discount. I know that word resiliency has been used by me a lot. I'm not getting paid for saying it, but I really believe that that's also something you communicated, and I don't want you to miss that part. I think that SCAGO, with its mandate to serve folks with sickle cell, we have a counseling arm, and I do think that families have been a focus, not just individuals. We can do some short-term things and then look for things that are longer term. But I can see the benefit of starting from that sickle cell piece if you feel like that's a central issue, and that having that validation for her experience would be helpful from that starting point, and then moving out to something a little more generically oriented, if that would be of benefit. So I hope you'll send her our way, and I can share more about how to do that. Thank you.
The only other thing I would think a bit about is possibly, is there something out there for chronic diseases in general? Children of parents with chronic diseases. I think if we go a bit broader, step back a bit, there could be something, some sort of group, because I can't, this is not an isolated kind of thing you're bringing up. I'm sure someone has built it, just not for sickle cell yet. So I think it's fair, and maybe it's out there for sickle cell, but we don't know about it. Thank you, guys. Thank you to all the panelists. I think it was great to hear from patients, parents, in multiple languages, and then also clinician, the most diverse panel we've had, and I did a lot of learning up here today. One of the things I took away with me, I just jotted down here, was really the need to not wait. If something is missing, then create it or push it forward, advocate for it. Go to whoever needs to hear your voice to help you move it forward. Because if we keep waiting for the decision makers to move things forward, we are going to just continue waiting, so let's just do it. So I felt this across the panel, that community is important, being informed, and helping your child to advocate for themselves. Because sometimes I find, as my last point, sometimes I find when patients come to the emerge department, oh yeah, right there, right? When patients come to the emerge department, they try to advocate for themselves, they become the difficult patient. And now they're actually getting poorer care because they spoke up. So how do we speak up in a way that we will not then suffer for being informed about what it is that we want? Right? So it's beyond, I think, beyond just speaking up. How do I speak in a way that I'm speaking your language? You'll understand what I'm saying, and no, I know what you're supposed to be doing, but I'm doing it respectfully so that you don't then make me that difficult patient. So thank you all for joining us today. I will invite somebody back up here. Thank you.
Hello, everybody. I'm somebody. I would like to just acknowledge everyone. Thank you so much for being here. And we are actually at the last session, so I would like to welcome up Ms. Landry for the closing remarks.
Well, we're getting there, ain't we? Good afternoon, ladies and gentlemen. And you will agree with me that it has been a great 2 days of amazing learning opportunities and networking. I've met many great people. Some of you have met virtually. Now I'm putting faces to, meeting you. And I always say the strong always last. So you're here because you are the strongest people that we have in this summit. So thank you so much for still being here and sticking it with and sticking it out with still the end. Congratulations for making it. But we're not at the end, just for you to know. But we are shortly closing the CME accredited portion of this summit. There is still the Industry Alliance Symposium. And I know, but this is very important. It's a session that is bringing the clinician, the patients, and the industry together to discuss the innovative therapies, what is in, and we've had that before, but we just want to get the perspective in a close, room sort of discussion, a candid discussion, what is in the pipeline and how does patient get access to these therapies. And it's a session you do not want to miss, so I want you to stay with me for that last session. It's in your agenda. You can see it. Industry Alliance Symposium is important. You do not want to miss that. It's going to be in the Oduwole room right after we close this portion of today. So you're going to grab your refreshment and you're going to head over to the Oduwole room and we're going to have a great session. In that same room, we're going to disclose, we're going to have a raffle of 5 attendees that is still here with us that registered as one of the first 100 people to register. We're going to have a draw and they're going to win their cash prize of $200 each. Amazing. You want to stick around for that. I encourage you. In closing, I would like to thank every one of you for attending the Summit 2024. and helping us to make it a resounding success. To our speakers and moderators, your knowledge and expertise has impacted the summit attendees, and we know that the healthcare providers that attended this summit have learned a lot more, and this is going to be reflected in their day-to-day practice and care of people with sickle cell disease. I would like to spotlight 3 healthcare providers quickly, and I'm sorry that I'm putting you in the spotlight. I didn't tell you before, but I have to do this. Ann Baylis, I want you to stand up. Dr. Ann Baylis. This is one woman who is not only a healthcare provider, she's an advocate. She reached out, I think last year or something like that, and she said Trillium Health needs to have a sickle cell program. We need it. And I'm thinking, Trillium is in Mississauga, it's close to Brampton, why bother? But she won't let go. She said, we need to do it. We have to do it. We have a large population. Let's do it. Let's do it. And I can tell you, she's done it. With a little bit of Skego's help, they've got funding for their program for sickle cell at Trillium, and I want to thank you. Thank you, Dr. Baylis. I would like to also spotlight Dr. Haswala. She came all the way from Missouri for this summit because she met with me and she said she attended our session that Dr. Susan Williams did, a webinar for Skego, and she was so impressed by that session, she decided she has to come to this summit, and I'm just like, oh, that's amazing. So thank you, Dr. Haswala. Thank you, Dr. Susan, for whatever you've done to make her come down. Thank you. And I would like to spotlight Donnell Hyvee. I don't know where she is. Over there, Donnell Hyvee? Dr. Donnell Hyvee is a board member for Global Action Network for Sickle Cell and Inherited Blood Disorders. We work together at that level. And he only heard about Skego Summit, he said, just a few days ago, and he said, please, can I come? And I'm like, you begging to come? Just come. You know, so I really want to say his heart is in the right place. And thank you so much. I want to thank, honestly, our sponsors. We couldn't have been able to do it without our sponsors, Vertex team. Over there, please wave Vertex. Thank you. Thank you. We have Novo Nordisk. Novo Nordisk, thank you so much. We have the Supporting Black Business Initiatives, and we have Editax that also supported, and we want to thank every one of you for your support of this summit. We also know that the attending patients and caregivers that have attended these 2 days have improved their knowledge on how to effectively manage sickle cell disease. Because our end goal with this meeting is great to see each other, but is to actually improve our knowledge so we can reduce morbidity, mortality. You know, we keep losing our young people, young adults. Transitioning from pediatric to adult care is very challenging still, even in Canada. And so by knowing how to better manage the disease as patients, as parents, and our caregivers can effectively deliver is how we can ensure that our children are living longer and fulfilling their purpose in life, right? That's what we want. And so thank you so much for being here. I'd like to also appreciate Skego's community partners, Taibo, Black Creek Community Center, Durham Community Center, Risedale Community Center, Roots Community Services. Jamal, shout outs to you. I see you. You're there. Thank you so much. And Black Earth Alliance. You are amazing. Thank you so much. Thank you. We'd like to thank our hospital partners for working with Skego to ensure that people with sickle cell disease receive quality care in our hospitals, to Ontario Health and Ministry of Health, we thank you for listening, for your commitment to quality standards for sickle cell disease. I remember in 2018, this is where the quality standard statement discussion started. I was having a meeting with Ministry of Health, and I was so frustrated about the sickle cell trait not being disclosed automatically. And that bureaucrats from the Ministry of Health said, maybe we should develop a quality standard for sickle cell. And I said, what good is that going to do? Is it just going to be another document? Or is it that really going to impact, right? And they said, well, let's do it. And that's how this started. And now we have the quality standard statements. We have all of this out. And I want to say, we really appreciate that the ministry, is so much committed and, looking to help drive change when it comes to sickle cell disease. So I'm very grateful to Skego's board of directors. This is your organization, and you have continued to uphold Skego with integrity. You are stepping up in every situation to defend its values and move it to a level comparable to similar disorders serving mainstream populations. Thank you so much. To our contractors and volunteers, without your hard work, we will not be here, so we thank you for all you do. To the Task Up team, you have always worked with me for little or nothing when I call you, and I thank you for supporting the Skego Summit 2024. Now for day 2, I know there should be a QR code up there for end of day 2 survey. Let's put that out there so people can actually help us evaluate the day 2 of this summit and help us understand what we need to do better for next time. And I think you all know there's a QR code to be scanned for parking. Please don't forget to do that. Again, when you leave this room, grab refreshments, and let's go to Holderwood Room after that one session with our industry, our clinicians, our patients, and let's talk about the pathway to ensuring that patients will have access to the innovative therapies that we are so much talking about. Thank you again, and we look forward to seeing you at Sickle Cell Summit 2025. Thank you, thank you, thank you.